So today we have a particularly relevant topic to today's day and age. We're going to be talking about how Ontario hospitals are tackling the surgery backlog related to COVID using digital patient engagement. Josh, if you want to explain a little bit on how COVID has affected surgery and from what you've heard from our surgery partners and our hospital partners, that may be a good place to kick off.
Yeah, I mean, I think just in general, one of the things that people, more so people in the public, I didn't realize at first is that the impact of COVID wasn't just about that you have, patients like with COVID, like in like more of them admitted in beds, but that has like an impact on like the rest of the hospital's capacity, like in many different ways. So, for example, like an unexpected one. Well, I think now it's common sense, but an unexpected one is that if patients are afraid of coming to hospital and getting something like COVID, but they're sick. Maybe their heart failure got worse, or their asthma got worse, or their infection got worse, and they're choosing to stay at home instead of coming to the hospital when they need to. Well, they're going to end up in the hospital anyways, but they're going to end up very, very sick. So maybe a patient who got sick could have gone to the emergency department, gotten treated, and then gone home now has a much worse condition, ends up being admitted in hospital instead, takes up a bed anyways, is turning out to do worse health wise,
Mhm.
and then creates more strain on the healthcare system. So I think there are a lot of unintended consequences of COVID in terms of how it's affected how people have used the hospital system.
Mhm.
And so I remember I had a friend who's an ER doctor here at an academic hospital in Toronto, and she was telling me, back in the late spring, early summer, when a lot of people were afraid of getting COVID, they were afraid of coming to the ER. The ER was empty early on.
Hmm.
Like people just weren't coming, and they got scared, saying, "Oh my God, these patients who have real emergencies are not going to come in on time."
Right.
Um, and then I would say more recently, what we've heard, Alan, is that there have been stories coming out about, um, you know, patients with cancer who, really needed cancer surgery sooner. We're kind of delaying getting cancer surgeries done, or maybe the backlog impacted that. And now the rates of late stage cancer are higher than they were at the same time, in previous years, because people are waiting longer. And I think now we realize, okay, like there's certain things that just can't wait.
Mhm.
Like heart surgeries can't wait, cancer surgeries can't wait. Maybe most orthopedics can, but then
Mhm.
people are in a lot of pain and like dysfunction. So I think that's a big reason why we have to find a way to do business as normal, including surgeries. Um, Both for the fact that I know some hospitals, like in the U.S., need to keep business going, but even back here in Canada, where it's a public system, like patients can't wait for a lot of these surgeries, Alan. Like
Right.
their health is actually on the line if they have to wait.
Mhm. Yeah, it's interesting. So it's both patients initially having a fear of going into the hospital during this time, but then this backlog that you're talking about as well. I think earlier in July, there was an estimate of maybe a 5 to 10 year backlog for non-emergent surgeries that were all put on standby for COVID patients. And then actually recently, just last week, there was a publication that came out in the Canadian Medical Association Journal. Basically, they studied, how many non-emergent cases are there in Ontario? So just Ontario alone,
Mm.
and it's near 150,000. I think it was 148,300 and something in the backlog. And from that analysis, they determined it would take about 84 weeks at having about 715 plus or 717 patients per week just to clear that backlog, which is an accelerated pace on all of these surgeries. So doing more surgeries than we did pre-COVID, and it would still take over a year just to clean up that backlog, almost a year and a half. And so with that in mind, I think it's obviously crucial to talk about solutions here and how can we attempt to tackle some of this backlog. And obviously, digital patient engagement plays a role in doing so and in keeping patients safe and prepared and all that for their surgery outside of the hospital. Um,
Yeah, Alan, maybe I'll just quickly add. I think maybe before we even get to how digital patient engagement can help, I think it's worth
mhm,
talking about like what are the sort of current activities or workflows that we need to find efficiencies around, which then I think kind of then leads into, okay, can digital help with some of those things? So some of the things that come to mind just to mention. So, a lot of our Ontario hospital partners who used to have in-person pre-operative classes, so very common for orthopedics, patients would have come in for these hour-long workshops about how to prepare and recover for, let's say, a total joint replacement. All those in-person classes were canceled during COVID because you don't want someone picking up COVID in that class, right? Um, or for example, a lot of maybe physio and recovery exercises, patients want to do that at home instead of going to a physio. But when you're being given these, paper booklets and illustrations, it's hard to learn some of those exercises, right? You need something more interactive to learn. Or the fact that we would rather a patient maybe go home half a day or a day earlier after surgery in hospital so that you could free up a bed for a new patient and reduce that backlog now. But you have to be confident you can send that patient home.
Right.
And then also in the post-op follow-up visit, I know a lot of visits have been switched to video visits and virtual, which is good. But does every patient need a follow-up visit? Or if there was a way that we could know that they're doing fine, that their incision looks okay, maybe they don't even need a follow-up visit, whether it's virtual or in person. And then that surgeon could spend that time having a new surgery appointment for a patient who needs an urgent surgery. So there's all these inefficiencies that I think have always existed, Alan, but it's almost like the pressures of COVID have emphasized the need to address those efficiencies. And then now that we recognize that, okay, now the conversation's about how can technology help streamline a lot of those inefficiencies that always existed, frankly, but just weren't as highlighted as they are now.
Right. Yeah. I think you bring up a good point as well around the virtual visits. I think we did an excellent job, Canada and the United States, with their hospital departments jumping onto virtual visits and getting, those video visits set up. But you bring up a good point. Maybe not every patient needs to have a virtual visit. Is there a way that we can screen without maybe having that whole video appointment and really tell if a patient needs that or not? And I think that's one area that digital patient engagement can definitely help with. Would you be able to speak to how digital patient engagement has been used so far in Ontario, or kind of what the history has been like for digital patient engagement for surgery in Ontario?
Yeah, and like SeamlessMD, I'm proud to say has been one of the pioneers of that here in Ontario. I mean, we started this company back in late 2012, early 2013, and so early on, we had partners like Michael Garron, where we started there in thoracic surgery and had some really great success. Reducing procedure cancellations, reducing ED visits. We've done work over the years with the Sunnybrook Holland Center, one of the large hip and knee surgery programs in the country. And one of the great things that they did was seamless early on. I think we started working with them in 2015. They put videos of their physiotherapists on the platform, explain how they do all these exercises. So, I mean, the fact that they already had Seamless in place for a number of years now meant that when the pandemic happened, they already had all these multimedia components on Seamless for their patients. And, more recently, going live, frankly, like just several months before COVID was, Trillium. And as soon as COVID hit, we made sure that, okay, let's make sure that their pre-operative surgery class was recorded and available on Seamless, so that way they could watch that remotely and still come into hospital prepared to have their their hip or knee replaced. So we've done a lot of work there. And then I would say more recently, because of COVID, we've had even more, let's call it more rural or more remote hospitals like Thunder Bay, like Health Sciences North and Sudbury have started partnering with us lately so that we could better support their patients who often live hours away. And so we definitely had early work done here, and it's been kind of more emphasized recently. But I would say like a big turning point in the province was back in 2017 when a vendor of record actually was established here in the province for solutions like Seamless for surgery. That was a big milestone.
And what is that vendor of record?
Yeah, so for those who aren't familiar from Ontario, we have this organization called Ontario Telemedicine Network, or OTN, and so this was the government-funded organization that led a lot of the video visit technologies and frameworks for many years, like probably well over a decade.
Mhm.
And starting probably about 5 or 6 years ago, they realized that okay, there's going to be a lot more technology adoption in Ontario beyond video visits, and OTN, it isn't in Ontario's best interest for them to try and provide technology for everything. And they saw the value of innovative partners like Seamless being able to help provide new technologies to providers and hospitals and patients, but they wanted to make sure there was a way to vet all of these solutions at the provincial level so
Mhm.
that hospitals would know which solutions were good, which
Right.
solutions were effective. And so they started creating this idea of provincial vendors of record. And it made sense for OTN to be the body that established these because they had a lot of credibility from the province.
Mhm.
And so basically in 2017, they established a vendor of record for digital solutions for surgery. And Seamless, unfortunately, was one of three vendors, and actually the only Canadian vendor to have been selected for this vendor of record. And we were selected based on the strength of our security, the strength of the results and the evidence that we've developed, and the strength of our feature set matching what OTN heard from hospitals that they needed to deliver better surgery. And even though this vendor record has been around for 3 years, I would say it's not been until 2019 that hospitals really started looking at it. And then obviously in 2020, it's taken off because everything that's happened with COVID. But the province did a good job laying the groundwork for this. I think it was ahead of its time, to be honest, Alan.
Mhm.
But that early work that the province did has really paid off because now the province is ready for when COVID hit to kind of roll out digital.
Yep. Yep. Excellent. And in terms of how digital patient engagement is actually working, so on the OTN vendor of record, for instance, procurement becomes really simple because the solutions have already been vetted by this third party, and it makes it easy to procure because we know that it's safe and secure and it's used by other Ontario hospitals. When COVID did hit, in terms of specifics around patient risk and prioritization, how does digital patient engagement actually help hospitals to kind of serve their patients better with the surgery backlog?
Yeah, and a lot of it comes down to aligning with what's important for each organization. So, even something like Seamless, we have so many different workflows and features that an organization could use if they wanted to. And then ultimately, we end up helping them configure the platform to address what specific workflows or needs that they have. So, for example, some organizations are using Seamless to do COVID-19 symptom monitoring and screening for patients or for employees. We've done that too. And so you can imagine for surgery, maybe preoperatively, some programs actually want patients tracking COVID-19 related symptoms, travel history, contact with other patients,
Mhm.
etc. Tracking those data points, maybe the week leading up to surgery, so that if a day or two before surgery, the patient starts developing symptoms, well, then the hospital is aware of it, it gets flagged, and then they can kind of determine that patient's risk. Should they still be having surgery? Should we take a different set of measures for that patient, as opposed to the patient showing up on the day of with 3 days worth of symptoms that frankly should have been caught sooner?
Right.
Some groups are actually putting and updating content on the platform around, what does a patient have to do differently in hospital in the world of COVID-19, so that all the information at their fingertips, they're prompted about it, they're ready for it. So that's been very important too. I would say, particularly on the post operative side, Alan, we talked about it earlier, but the fact that a patient can actually track common symptoms, warning signs,
Mhm.
issues on the platform, whether it's pain scores, temperature, if they're nauseous, they're vomiting, photos of their incision, and that team member can actually keep an eye on that, and catch it earlier,
Mhm.
avoid an in-person visit, prevent an ER visit or readmission, or avoid that follow-up visit entirely. That's been good for both keeping the hospital more efficient, but also good for a patient who doesn't need to come into the clinic or hospital, being able to stay at home safely with their family.
Right.
Um, that's
Right.
been big too.
They get all the education given to them, so they don't have to call in if they have questions around it. It's usually all answered by the digital patient engagement program. So that's neat. So basically, it's this digital patient engagement, which was being used already to guide patients through surgery. And then we're now able to add different COVID related materials to it as well. I know for SeamlessMD specifically, we did also partner with Wolters Kluwer on some education, for instance, with videos, like up-to-date information on COVID. So things like that can be added to the platforms, obviously. Josh, you mentioned already around some of the history in Ontario with digital patient engagement, the different programs like Trillium and Sunnybrook, and how they've used it to reduce cancellations, ED visits, readmissions, even at Sinai Hospital in Toronto. In terms of how these programs have leveraged the technology during this period, you touched on some of these programs have now included their pre-op classes on the platform as a video format. Is there anything else that the platforms are doing for these hospitals or that we've been doing with our partners recently?
Yeah, probably the more really exciting thing has been this Supercluster initiative that we've had the fortune of leading. Sounds really cool, right? Supercluster.
Yeah.
But but for those
What
who
is it?
don't,
Yeah.
what is that? Well, um, so the federal government over the past year has been funding a number of what they call supercluster projects across the country to help technology or industry partners solve important problems. So, for example, the government has funded a number of different supercluster projects for tackling climate change issues. And then when COVID hit, the government decided to fund a number of COVID-19 specific projects. And so Seamless was actually selected to lead a national project to help hospitals use digital patient engagement and machine learning actually to help reduce the surgery backlog. And so what this funding is allowing us to do is actually support hospitals across the country, implementing Seamless for a number of different hospitals for surgery. So the idea is that patients having surgery at a bunch of hospitals can get Seamless pre and post op, so they can be engaged, they can be monitored, they can stay at home healthy, their care team can pick up, all of these issues. And it covers also integrating with EMRs and other IT systems. But the other really neat thing is that there is a machine learning component.
Right.
And the idea is that these hospitals are actually collaborating with us, where they're sharing de-identified surgical outcomes data with us. And we're combining that data with incoming real-time patient-reported outcomes data. So all that symptom data around pain scores and temperatures and recovery issues. And the idea is that we're leveraging machine learning to actually train more predictive models so that we can actually help providers get more intelligent alerts, more intelligent analytics to catch things like a cancellation or a readmission or an ER visit much sooner. And the way to think about it is, right now, normally, when a provider uses Seamless to monitor a patient, they're catching issues using very straightforward algorithms, Alan. So, if the patient records or they have a fever, well, then maybe a nurse or someone else gets alerted. They can, log in, look at the dashboard, see that the patient's, not doing well, call the patient back in, treat the patient sooner. And actually, we've been very successful reducing readmissions and ER visits to this very straightforward method of just like flagging symptoms that are concerning. But what's happening in this project is that we're actually using machine learning to do that more accurately. So the idea is that if we have this machine learning model that's been trained, imagine a patient who's been through 7 days of recovery, and based on the past 7 days of symptoms recorded on Seamless, and based on that patient's past medical history, their demographics, and so forth, the model actually says this patient has a 71% risk of readmission the next 3 days. Like, ding, ding, ding. This is the patient that the care team should reach out to. That's a level of specificity that we're hoping that we can demonstrate with this initiative. And at this point, we have, I think, about 7 or 8 different large hospitals in Ontario who've signed up for this initiative, who are going to be collaborating on this machine learning. So we're going to build a pretty predictive model. We'll have to see how much better this sort of machine learning approach can actually impact patient outcomes, because frankly, Alan, our current method has been very, very successful. And I don't know how much more we can optimize it. But it's going to be very exciting to see what will come out of this more advanced analytics model. And it's exciting to kind of have Seamless and our partners be at the forefront of making this happen. I haven't seen anything like this done in Canada or the US before. And so it's going to be really awesome to actually lead this effort and not only make surgery safer for patients, but show how machine learning could possibly do that.
Definitely. Yeah, I think this is a topic that's been talked about for a long time. And the challenge has always been around data and collecting data. And how do we have all this historical data, but we need more real time data to get more real time analytics. And digital patient engagement seems to be that solution because we're collecting things in real time, we're collecting patient symptoms in real time, we're tracking and following the patient throughout their recovery. And so it's really exciting actually combining these data sets together to finally potentially have this incredible engine that's able to predict certain outcomes like that. And I think to your point, Josh, like obviously with SeamlessMD, we have reduced readmissions using kind of the traditional method of catching an error or complication sooner and then reaching out to the patient. But if there's the potential to maybe get an even earlier warning sign and see it, within the next 3 days, there's that 71% chance of the patient being readmitted. I think everybody would want to take that solution. That makes a lot of sense. And it seems to be the way that healthcare is moving. And that's what I envision for the future of healthcare is having these very predictive models and analytics that are in real time. Would you have anything to add in terms of how digital patient engagement would be used in a post-pandemic world? I assume we're not really going backwards to how it was in the past traditionally, but we're probably going to be moving forward with digital
Yeah, that's a
patient
great
engagement.
point, Alan. And I think what I've heard from providers is that even if there's a successful vaccine or other solutions to the COVID-19 pandemic, I think providers and health systems are now very primed to the fact that this could happen again. And so even if we get through COVID-19 and we get to the other side, there's always going to be this belief that there could be recurrence or something similar, and the health system has to be re-engineered in a way that we're prepared for that. And so I think the fact that COVID-19 has accelerated digital adoption and it's helping health systems and providers understand, okay, like where does digital make sense? Like where does like virtual care make sense? And I think we're learning very quickly about all these great scenarios. We're like, wow, it actually makes a lot of sense. And we're probably also going to learn about situations where it doesn't make sense.
Mhm.
And I think you're going to find this in the post-pandemic world. I think there's going to be, frankly, not as many video visits as we saw initially in COVID, but I think it's going to be more because people will be more comfortable. They'll have a better idea of where it works and where it doesn't. And I think digital patient engagement is kind of the same thing in the sense that we're going to get an accelerated look at like where does it actually create value. And I think people are going to be pleasantly surprised about how many interactions we have with patients that can actually be successfully digitized and that it's actually better for both the provider and the patient. And the only thing stopping us before, to be honest, Alan, was a lack of conviction that patients could do this and that providers
Mhm.
could spend the time to make this successful, right? Like a lot of our providers now, once they actually have Seamless in the hands of patients, actually realize, oh wow, there are far more patients that have either access or ability to use
Mhm.
Seamless than I thought would,
Mhm.
right? And COVID has just kind of forced people to actually invest the time to see that this is true. Whereas in
Mhm.
the past, it's easy to make excuses like, oh, my patients won't use this.
Right.
Ah, they're full.
They're 80-year-old. Yeah,
Yeah.
exactly.
And
Exactly.
now it's like, well, actually, you have to find out that's true because we can't go back to the way the world was before. So
Right.
I think we're going to get a lot more experience in the next couple of years. And then I think we're going to see a lot of cases where a lot of things that we used to do in general, virtual or not, don't make sense. I think we're going to realize that, hey, a lot of these post-op follow-up visits just didn't make sense.
Mhm.
I think the one thing that's going to have to change, Alan, is probably the reimbursement model. So
Mhm.
there's still a lot of places, like let's say in Ontario, for example, where surgeons can bill for post-op follow-up visits, and so unless the government changes its funding model to be more based on a global fee or something more
Mhm.
value-based, surgeons are still going to feel
Obligated.
obligated to
Yeah.
have a post-op follow-up visit. And in fact, the ones who are able to monitor a patient and avoid a visit are going to feel they're being punished because they're being more efficient with the
Right.
patient's time and their time. They can't bill for it.
Right.
So I think the reimbursement models are going to have to change, Alan, to match the benefits of digital. And I think probably Ontario can learn a lot from what's going on south of the border about like what works and what doesn't when it comes to the payment models to properly incentivize more efficient digital care. But we're going to have to actually figure out those models so that we can sustain all the learnings and the benefits of digital. And I think if they don't fix the model, that could put the benefits at risk of, a few years down the line once we're past COVID.
Right. Absolutely. And just kind of closing that, I think COVID it's a great, in a way, a teacher. We're kind of learning what's working and what's not working, and what do we have to re-examine, and what do we have to change for the future as well. I think, to your point, there could be a worse pandemic one day, and so taking all the steps now to be prepared for that situation, it's going to be advantageous for everyone. And just a last thing that I want to add, it's neat that the common thread was always, my patients are maybe too old to use technology. I don't know if they can do that. I think it's neat now because we have real-time feedback from our patients, and patients are saying, we've had actual patient testimonials and quotes coming back in to the platform, basically saying, thank you for not having me to go into the hospital to do some of these exercises, or to go to this follow-up visit. Thank you for keeping me at home and giving me the right instructions where I am, and not having to go out into the pandemic environment. And so I think just having that from patients, hearing that feedback is all the testament that we need as a healthcare system to finally understand that even patients 80 years old can use this technology.
Yeah, and just to get a sense, Alan, of how much, to be honest, how much more I think work we have to do to change many parts of the culture in healthcare to go more digital. I was talking to someone, a couple of days ago who does patient education classes, and they only just started moving, of course, during the pandemic to Zoom-based classes for patients. Okay, that's a good first step.
Right.
And it's only recently that they realize, why haven't we recorded these classes on
Right.
Zoom even, so that a patient who can't make the class can just watch it at their leisure. And when you think about it now, you're wondering, wait, how is this never recorded even like a year or 2 or 5 years ago?
Yeah,
right?
even in person,
recording.
Yeah.
Like, why was it that we always needed people to come in person and drive 2 hours for this in-person class that frankly should have been recorded? And so I think there's still clearly ways to go in the culture in healthcare to really understand the power of digital. Even beyond digital patient engagement, even things as simple as recording a class and getting it to your patient virtually and recorded. There's just so much more opportunity to leverage these technologies, Alan. And that's what makes it exciting, though.
And I think that's then another discussion, because there's always going to be some providers that are saying, well, I like to have that personal connection with my patients. I don't want it to just be a recorded thing. And there's room for that too, using digital. It's it doesn't have to always just be the recording. It can be, a live class, but over digital, and then record that to send out to patients that couldn't make it, or even just to send to those same patients as a reminder, and they can keep going back to the class and keep watching it, and do the exercises along with them. So I think there's definitely room for digital and how we can kind of tailor our programs for the future, and still have that personalization and still have that connection with our patients.
And I think it goes back to, sorry, I'll make one last comment because I don't want to belabor this podcast, but I'm a really big believer in that everyone needs to be reached in a different way, in a way that makes the most sense to them. And you and I have talked a lot about this from a Seamless point of view. We talk a lot about, okay, well, some patients, like getting SMS or text reminders. Some prefer email. Some patients prefer the web app over the mobile app, or vice versa. I think even the same way, right? There are going to be some patients who prefer that real-time one-on-one interaction. Some patients are going to prefer, just getting a recorded, video of the lesson, so they don't have to do direct interaction. Some people like group classes, some people like one-on-one classes. But I think the power of digital is that you can better serve all those kinds of patients and kind of drive up patient compliance and comprehension better, because you're able to cater to all kinds of learning styles. Seems obvious now, but it's kind of strange that this wasn't the case before, that we would just force every patient to learn one way. And expect it all be equally understanding of it.
Yeah, I think also, just kind of adding to your point there is the extreme end of accessibility as well. Maybe there's a patient who's blind, for instance, but they're still using digital technology. It's just in different ways. So maybe it's screen reader friendly and it's actually reading out the instructions to the patient so they can hear it. So there's different modalities of learning styles that digital accommodates for almost all of these modalities. So I think definitely to your point, it makes a lot of sense that digital can kind of take over and make things more efficient for the healthcare systems.
Alan, we're gonna get to, now maybe this the a good way to end the podcast, but maybe we're gonna get to a world where it's so consumer focused as a patient that it's like when you get a Peloton and
Mhm.
the Peloton or Peloton, right?
Peloton, yeah.
Peloton, and you have these like classes where you can choose which like
Which
instructor
one?
that you go, and it's like, hey, maybe at some point I can choose which instructor I get for my
Yeah,
pre-surgery knee class,
yeah.
and
So
and I,
definitely.
it's so consumer driven that I can choose who I get my you know
That would be
virtual
neat. Yeah. And it's like a virtual class with other participants as well, and
yeah.
they can all do it together. Yeah, I like that. Maybe there's
That's
one
pretty funny.
instructor that has a clearer voice that you prefer, or something like that. Yeah, that's neat. That's cool.
Hey, I
Uh,
mean, don't knock it. At some point, there's gonna be you're gonna wake up in a hospital, Alan, and the nurse who's taking care of you is an AI, and you're able to choose their accent and their uh, their hair color and everything you want.
yeah, no, I can see that. It's all virtual. Everything's done virtually at some point. That's great. Well,
Yeah,
awesome, Josh. We probably shouldn't make this podcast an hour long. It's just the two of us tackling this topic, so we can end it here. But I think there's a lot to be learned from what Ontario is doing currently, implementing digital patient engagement, and how they've adapted the programs now to help with COVID and to help with tackling the surgery backlog that is inevitable and is here. So I'm excited for this, for instance, the Supercluster initiative you talked about, and just how we can modify and adapt to more of a digital world moving forward to help with some of these cases like surgery backlogs and COVID cases.
awesome. Me too, Alan. Thanks for highlighting this week.
Amazing.
Appreciate it.
Thanks, Josh. See ya.